A game changer is literally something that alters the way we do things. And we don't have a lot of game changers that come along every day in medicine. We constantly are trying to do things in a better way and in a more efficient way. I like to use the word game changer with this because it is fulfilling a huge void for women. This is almost immediate. As part of the protocol, we had patients, we would see them 1 week after their first treatment. And hands down, there was improved moisture, less pain, less pressure. This is very exciting to me as a researcher because I think this is just the tip of the iceberg. This area of vaginal and vulvar atrophy, which basically means the vaginal tissues become dry, they become very sensitive, is a huge problem. There's really not a lot of epidemiologic data, but millions and millions of women suffer from this. And unfortunately, most of them suffer in silence. So this is a very, very needed therapy. I was very willing to try this because it's a huge need. It's a huge therapeutic area. The other big group of women that are truly suffering in silence that can't even take the medicines are breast cancer survivors. I can just tell you that I am blown away with how well it works. The therapy takes somewhere in the range of 3 to 4 minutes to deliver. It doesn't require any anesthesia, no creams, no Valium before, nothing. There was not one patient that could not tolerate it. It's a probe that goes into the vaginal canal, and then you deliver the laser therapy. There's no pain with the laser therapy. Sometimes putting the probe in on that first therapy just because their vaginas are tight and sensitive is a little bit painful. But again, we did not have one patient that couldn't tolerate the therapy. Hands down, 100% of the patients have had improvement. It penetrates the wall of the vagina and stimulates cells that are important in creating fluid, improving collagen synthesis. It's a very, very scientifically validated mechanism of the way it works. So this is real, this is legitimate, and I'm very excited about it. This isn't about enhancing sex. This is about treating a medical condition that basically occurs in almost every woman that goes through menopause. So you would want to make sure that they're not being pulled into something that hasn't gone through the scientific validity and the due diligence required. I would say that if you've got these symptoms and you can get to a physician that is able to deliver this MonaLisa Touch therapy to you, not too many things you can say there's no downside to it. I really don't see any downside and a tremendous potential upside.